Dr. Richard Besser now, former acting director of the CDC. Doctor, thank you. You know, there's an ongoing debate about whether we should rush one dose, as Meg was reporting, to as many people as possible in the face of these variants, or stock up to guarantee 2 doses to those who are eligible. What's your thinking?
Well, I go with Dr. Fauci on this one, Shepard. And one of the big reasons is that, as these vaccines were being reviewed by the Food and Drug Administration, by their expert advisory committee, they looked at the data and they approved them based on the way that they were designed in these studies. And that's 2 doses spaced appropriately, 3 or 4 weeks, depending on the product. And I have concerns that if we go to a 1-dose regimen, that we could be providing people with suboptimal levels of protection. As you talked about the strain in South Africa, one of the things we don't know about those vaccines is how effective they were against severe disease, against hospitalization and death. Only the J&J vaccine had some of that information. So it's possible that although the vaccines didn't prevent the mild to moderate infection, they may be able to have some role to play in terms of the most severe cases, those that cause hospitalization and death.
Dr. Besser, we're in kind of a new place with this virus. Case numbers dropping, but the threat of dangerous variants is rising, and that's all kind of new to us. What should officials do? On what should they focus when deciding the right time to reopen?
It's a real challenge. Everyone is tired of having their lives curtailed by this pandemic. People want to get back to doing what they enjoy. But it is a critical time here. The numbers going down, it's very exciting to see that. But the experience from the UK, where they had a variant that spread much easier, much more rapidly within the community, says to me that we could be in a similar situation here if we let our guard down. And by that, I mean, if we have states that say you no longer need to wear a mask or social distance, go ahead and travel, those would be big mistakes. Opening schools, getting kids back into school for in-person learning, that's something where the science says we can move forward with that as long as schools have the resources that they need. But opening restaurants and increasing the size of gatherings, I think it's too soon to move in that direction.
All right. Well, earlier today, the former FDA commissioner, Dr. Scott Gottlieb, raised concerns about some of the new variants piercing prior immunity. In other words, potentially reinfecting those who've already had this virus. How worried should the millions of people who've already had COVID be in this country?
Well, it's one of the reasons why you want to see CDC stepping up, and they are stepping up, to look at more isolates around the country to see, are we seeing the variants spread around the country? Where is it more concentrated? Another way that you can look at that, and I know there's efforts to do this, is look at people who have had COVID once and then get infected again and sequence the viruses that are affecting them to see, are they more likely now to be getting infected with one of the newer strains? That'll give you some sense as to whether a previous infection with the older strain provides protection against the newer strains.
Dr. Richard Besser, lots of work ahead. Thank you so much. Shepard Smith here. Thanks for watching CNBC on YouTube.